is the last of the hip muscle videos that I'm going to do. I'm going to cover the gluteal muscle group and the short external rotators at the hip. So when we think of glutes, we normally think first of the gluteus maximus, which is the largest and most superficial muscle in this area. It comes from the sacrum, coccyx, iliac crest on down, inserts partly at the gluteal tuberosity on the posterior side here, but most of it also inserts into the iliotibial band, which then goes down farther along the femur and eventually attaches closer to the knee. Also in this area and attaching to the IT band is the tensor fascia lata, or the TFL, and that comes from the ASIS and directly posterior, then inserts into the IT band. Underneath the glute maximus, we have the glute medius and glute minimus, and they're just kind of stacked on each other, like if you think a stack of pancakes. We have glute max, you take that pancake off the stack, then you have the glute medius, and that starts underneath the edge of the iliac crest and comes down here to the greater trochanter. You take the gluteus medius off the stack, and you have the gluteus minimus, which starts along the ilium inferior to where the medius would start, and that also goes to the greater trochanter. Then from there we have short external rotators, which include the piriformis, which I've covered in a previous video. It comes from the anterior sacrum through the sciatic notch to the greater trochanter. We have the superior gemellus. I know it sounds like a pasta, it's weird, but it comes from the ischial spine to the greater trochanter. We have the obturator internus, which comes from the internal side of the obturator foramen. You can see where my fingers poke through the hole. It's coming from the inside border of the hole, that membrane, coming down here to the greater trochanter. We have the inferior gemellus, which is coming from the ischial tuberosity area to the lower part of the greater trochanter. Then we have the quadratus femoris, which is the lowest or the most inferior of the group, coming from the ischial tuberosity down to the inner trochanteric line. Now, how are some ways we can group them and think of them together? Well, we have been noticing, most likely, that most of these short external rotators, they all come in either right at the greater trochanter or just below it. So that's one of the commonalities for this group, is they're all coming in right in this specific region. One of the other things this group all has in common is innervation by the sacral plexus. That's kind of down in this area here, and then it'll branch off into the tibial nerve and other ones down farther along the leg. Then the gluteal muscles don't all share the same innervation. It would make sense if they did, but not quite. If we go back to the pancake analogy, the gluteus maximus, the top one on the stack, it's also the one that goes down the farthest. The two underneath it are clustered more here at the ilium and then just go to the greater trochanter. They don't go much farther south. But the gluteus maximus comes down a lot farther, so the gluteus maximus has its own nerve. It's the inferior gluteal nerve. The gluteus medius and minimus, as well as the tensor fascia lata, are all three innervated by the superior gluteal nerve, because they're all clustered up a little higher. They don't go down this far. So in this area, we've got superior gluteal nerve, inferior gluteal nerve, sacral plexus. And then the short external rotators here, if you just think of them just straight down the line in terms of origin. The insertion's all pretty much one common point, but as far as origin, it goes piriformis, superior gemellus, obturator internus, inferior gemellus, and quadratus femoris, which, not to be confused with the rectus femoris, which is over here on the anterior side. And all of these muscles have more than just this one action that they're responsible for. This is the action they all have in common, but here as well